Hello, you're welcome back to my channel. I am pharmacist Charity Amaka. So today we'll be discussing a very important topic, which is the possible reasons why you are not getting pregnant yet. And of course, the solutions to those problems. So if you're interested in this, stick around. Let's get into it. Let's start by understanding how conception happens and then link it to some common issues that could be standing in your way to getting pregnant. Like most of us already know, conception happens when an egg from the ovary meets the sperm from a male partner in the fallopian tube. So the sperm fertilizes the egg, and then this fertilized egg travels to the uterus and implants in the uterine lining to begin a pregnancy. Now, this sounds straightforward, but a lot of things need to go right for it to happen. First, we need a healthy egg and a healthy sperm. And the fallopian tubes need to be clear for the egg and sperm to meet. The uterus, that is the womb, also needs to be ready to receive the fertilized egg. So, if there is any problem in this process, then it can affect your ability to conceive. Let's look at some common problems that can interrupt this process of conception and of course the solution to each problem. 1. Problem with the egg. If the egg has issues, whether it's the quality, like if it has low quality or is not even being released at all, then conception will be affected. Conditions like PCOS, that is polycystic ovarian syndrome, or even age can affect egg quality. You know that the more you age as a woman, the more the quality of your egg declines. So if you discover that you have poor egg quality, what are the possible solutions to this? We have some supplements that can help to improve egg quality. Supplements like coenzyme Q10, what we call CoQ10, omega-3 fatty acid, and melatonin. Sometimes medications like clomid or letrozole may be used to stimulate the ovaries to produce more eggs, potentially increasing the chances of getting a healthier one. Now, assuming the egg is okay, but the sperm has issues, conception will still be affected, right? That brings me to the second point, which is problem with the sperm. Sperm health is very important, and issues like low sperm count, poor sperm quality, and motility can significantly reduce your chances of conception. Let's start with the sperm count. Normal sperm count is at least 15 million sperm per mil of semen. So if a man has lower than this, he will be battling with low sperm count. Or if a man has less than 39 million total sperm per ejaculate, that is also a problem. So how do you determine if your sperm count is normal? You can run a semen analysis to find out if your sperm count is low or normal. Also, sperm quality, which means the shape and health of the sperm, is very important because abnormally shaped sperm might have difficulty penetrating the egg. Sperm motility, which refers to how well your sperm can swim, is also very important. And at least 40% of the sperm in a semen sample should have good motility for a higher chance of reaching and fertilizing the egg. Now, what are the possible solutions to sperm issues? There are some supplements that can help to boost sperm count, quality, and motility. Supplements like zinc. Zinc is very, very essential for sperm production. So we have zinc, omega-3 fatty acids, vitamin C, vitamin E, and folic acid. Folic acid is also good for men. It's not only women that take folic acid. Folic acid can support sperm production and quality as well. Lifestyle adjustments can also help in managing sperm issues. Lifestyle adjustments like reducing alcohol intake, quitting smoking, avoiding hot jacuzzis. Heat is one of the biggest enemy of sperm production. So if you are battling with low sperm count, sitting in a hot jacuzzi is not good for you. It can raise the temperature around your testicles, which can reduce sperm production and also affect sperm quality. Even carrying laptops on your laps for an extended period of time is not good for you. It can overheat the testicles and disrupt your ability to produce healthy sperm, so you can use desks instead of placing laptops on your laps. Let's move over to the third problem that can affect conception, which is problem with the ovaries. The ovaries are responsible for releasing eggs during ovulation, right? So any issue that affects or disrupts this process can make conception difficult. Some common problems that can occur with the ovaries are 1. PCOS, polycystic ovarian syndrome. This is one of the most common ovarian issues that affects fertility. So what are the signs of PCOS? There is what we call Rotterdam criteria, which states that if you have 2 out of these 3 symptoms I'll be mentioning, or if you have the 3 of them, then you might be battling with PCOS. The first symptom is irregular or absent period. That is, if your period cycle length doesn't fall within 21 days to 35 days, or you don't even see your period at all, then it's a sign of PCOS. Now, the second symptom is excess androgen hormone, the male hormone called androgen. If you have elevated levels of this male hormone in your body, then it's also one of the signs of PCOS. And how will you know if you have elevated levels of this male hormone? If you're having excess facial or body hair, like you have excess hair on your jaw, your chest, and the rest of them, or if you're having excess acne, then it's a sign that you're having elevated levels of this male hormone. The third criteria for diagnosing PCOS is when you have polycystic ovaries on ultrasound. If you go for ultrasound and your ovaries contains large number of follicles, then you might be battling with PCOS. In a healthy ovary, you will have between 5 to 10 small follicles visible on ultrasound. But with PCOS, you will have more than 12 follicles on each ovary, measuring around 2 to 9 millimeters in size. And they remain underdeveloped, meaning that ovulation doesn't often occur. So this is why women with PCOS have troubles ovulating. Women with PCOS also experience weight gain, unexplained weight gain. Now, what are the solutions to PCOS? Most times they are given medications that can help to stimulate ovulation. Medications like Clomid or Letrozole. Okay, then they are also given metformin because they often experience insulin resistance, leading to that weight gain. And this metformin will help to manage that insulin resistance. Then supplements like myo-inositol can also help with PCOS. Myo-inositol is very good for women with PCOS. Another problem that can occur with the ovaries is ovarian failure, which is when a woman's ovaries stops functioning properly before the age of 40. This means that the ovaries no longer produce enough estrogen or release eggs regularly, which can lead to infertility and early menopause-like symptoms. The signs of ovarian failure includes irregular or absent periods, hot flashes or night sweats, vaginal dryness, and mood swings. But natural conception may be difficult with this ovarian failure since the ovaries are no longer functioning properly. So for those that wish to conceive, they are often advised to go for IVF treatment using donor eggs. Ovarian cysts is another problem that can occur with the ovaries, although they are usually harmless and resolves on their own. They don't often cause symptoms, but when they do, you might experience signs like pelvic pain. That is a dull and sharp pain on one side of the lower abdomen, depending on which ovary has the cyst. So most times, doctors recommend watchful waiting. That is, waiting for some time to know if the cyst may resolve on their own with regular ultrasound to monitor the cyst. They can also be given hormonal birth control pills to prevent the formation of new cysts. Then, if the cyst is large, painful, or showing signs of being cancerous, a surgery might have to be done to remove the cyst. We know that the fallopian tubes need to be open for the sperm to reach the egg. and also for the fertilized egg to travel down and implant in the uterus. The common problem that can occur with the tube is tube blockage or damage. And this blockage is often caused by pelvic inflammatory disease as a result of an untreated sexually transmitted infection like chlamydia or gonorrhea. So to find out if your tubes are blocked, you can go for HSG, which is a laboratory examination of the tubes. For treatment, they are given medications like antibiotics to treat that pelvic inflammatory disease and prevent further damage of the tube. Then surgery can also be done to remove the blockages and repair the tubes. But remember that you have 2 ovaries and 2 fallopian tubes, so you can still conceive with blockage of fallopian tube if it's only one tube that is blocked, okay? The only difference is that it might take longer for the conception to happen. But if both tubes are blocked and severely damaged, then IVF will be the only option. Now, what if there is a problem with the uterus? Will pregnancy occur? The 2 most common uterine issues that affect fertility are fibroids and endometriosis. Let's start with fibroids. Fibroids are non-cancerous growths that develop inside or around the uterus. Fibroids are very, very common, but not all fibroids affect conception and pregnancy. The size and the location of the fibroid matters a lot. So for the size, smaller fibroids do not usually affect fertility, but larger fibroids, especially those that are 5 cm and above, can change the shape of the uterus, making it harder for an embryo to implant and causing complications in pregnancy. Then for the location, if the fibroid is located inside the uterine cavity, the one that is called submucosal fibroid, then it is most likely to affect conception, because it can interfere with implantation of the embryo since the fibroid is inside the uterine cavity. But if the fibroid is located within the muscle wall of the uterus, the one that is called intramural, or it is located on the outer wall of the uterus, the one that is called subserosal fibroid, then it may not interfere with conception. You can get pregnant and have children with these types of fibroid. They do not always affect conception, except the size is large. If the size is very large, that is when it might interrupt. Signs of fibroid includes heavy or prolonged menstrual bleeding, pelvic pain, and pain during intercourse. Surgery is almost about the most reliable treatment for fibroid. If the size is large or is putting the patient in so much pain, then the fibroid might have to be removed. The vitamin D supplements can also help with fibroids too. It's very good for fibroid patients. For endometriosis, which is the condition where tissues similar to that of the uterine lining grows outside the uterus, often on the ovaries, the fallopian tubes, and the other pelvic organs. The most common sign is pain during menstruation, severe pain. For the treatment, they are most times given hormonal birth control pills or GnRH agonists to manage the symptoms, with pain relievers as well. Then, if it becomes unbearable, a surgery might have to be done. For those that also wish to conceive, you can still conceive with endometriosis, or you opt for the option of IVF. It has been a long lecture on understanding the various factors that can affect fertility and the possible solutions. I hope you gain value from this video. The journey to conception can be complex, but with the right information, lifestyle changes, and medical support, you can take meaningful steps towards achieving your goal. Don't forget to like, share this video, and subscribe to this channel for more insights on women's health and fertility. Thanks for watching, and I wish you all the best on your journey.